Namaste all. Welcome to SDM Ayurveda, an interactive online series. Myself, Dr.Suhas, will be hosting today's session. There is a worldwide consensus regarding the huge rise in the cases of drug abuse, and India is no exception to this. Even Bollywood has been in the news recently with some shocking revelations regarding drug abuse. Coronavirus has also added huge spike in the cases of drug abuse, especially alcoholism. Alcoholism does not only affect an individual physically, mentally, socially and financially, but also affects his family, the society, nation, and thus becomes a global issue. Today, to throw some light on this topic, we have with us a eminent speaker and renowned Ayurveda psychiatrist, Dr.Suhas Kumar Shetty with us.
Addiction is a global problem of the past, present and future. Addiction is a physical or psychological dependency for a substance or a behavior. The behavior could be gambling, internet, games or even food. Whereas a substance could be legal substances or illegal substances. Legal substances like alcohol and tobacco, and illegal substances like opioid, afim, charas, ganja, etc. And the addiction could also be for various pharmaceutical products like painkillers, cough syrups, benzodiazepines, etc. The alcohol is a drink which is commonly used in our practice is ethyl alcohol or ethanol, and it is prepared by various products using grains, vegetables and fruits. It is a fermented yeast prepared from the sugars of these products, and each of this alcohol can be of different percentage based on the type of the basic ingredient that is used. Like for example, when we use beer, it has 6% of alcohol. When we use wine, it has 12 to 14% of alcohol. The spirits like gin, vodka, rum will have in between 40 to 50%. Then what is a standard drink? A standard drink is the one which has 10 grams of alcohol in any drink. For example, 375 ml of beer and 30 ml of rum is a standard drink. When a person consumes this alcohol in any forms for any period of time, it can have various effects on the body. It depends upon how much you drink, how long you drink, with what you drink, your age, gender, and various factors affects an individual towards alcoholisms. Alcoholisms on long run can have various short-term and long-term effects. Short-term effects includes nausea, vomiting, lack of coordination, lack of behavior, lack of memory, nausea, vomiting, etc. Whereas the long-term effects could be psychological effects or physical effects. The common psychological effects includes the impact on the gastrointestinal tract like ulcers, gastritis, etc. And the major organ which is affected in alcoholism is liver. There could be fatty changes in the liver, liver hepatitis, fibrosis, liver cirrhosis and so on. And along with that, there are various changes that happens in the reproductive system, like there could be erectile dysfunctions, there could be infertility, and also it affects the brain. So there will be a lot of problems in the psychological functionings like cognition, memory, emotional control, etc. So alcohol, irrespective of the type of alcohol, irrespective of the quantity, can always have various ill effects on the body, both physically and mentally.
Sir, generally it is seen that people get into this habit of alcoholism as an extended version of paid drinking, especially men in their early 20s and all. So in your 18 plus years of experience, what are the common causes which lead to alcoholism?
Rightly said, Dr. Soumya. There are various causes of alcohol use disorders. We can broadly classify the alcohol use disorders into the biological causes, the environmental causes, the psychological causes and the social causes. Coming to the biological causes. Biological causes is a relationship of the genes with alcoholisms. It is not a single gene, but more than 51 genes have been related with alcoholisms. And along with that, there are various biological changes happening in the brain, especially the frontal cortex, the cerebellum, which gets affected on chronic consumption of alcoholisms. And along with that, there is an enormous release of various neurotransmitters like serotonin, dopamine, which can affect the alcoholic patterns. Coming to the environmental causes. The proximity to the various social retail stores, the alcoholism bars, can always make a person more curious about consuming alcohol. Even the advertisement that a person sees in the print media and the social media can always make a person more curious to consume alcohol. And it can lead from various socio-economic status from poor to rich. Coming to the social causes, the peer pressure has said to be one of the major causes of alcoholisms. People want to fit into a group. They want to be accepted socially. So that's the reason why, especially in the adolescent, people want to experiment this new habit of alcoholisms. That is where they get into the habit of alcoholisms. And along with that, the social, cultural and the religious factors can play a major role in causation of alcoholisms. And coming to the psychological causes, excessive stress, anxiety, depression, lack of sleep, emotional disturbances, emotional instability, failures, financial crisis can always lead to various types of alcoholic disorders. In total, it is a multifactorial cause which can lead to various types of alcohol use disorder.
So generally people show symptoms such as tremors of the body or sleep disorders as symptoms of chronic alcoholism, especially when they don't get the regular dose of the alcohol. So clinically, what are the other presentations with which they come?
The alcohol use disorders can exhibit in various clinical manifestations. It could be of alcohol abuse, alcohol dependency, alcohol withdrawal, alcohol induced symptoms, etc. When it comes to alcohol abuse, it is a continuous use of alcohol in spite of having the harmful effects. In spite of having various physical changes and psychological changes, a person still continues to use these alcoholisms, and that is what is alcohol abuse. Whereas when a person becomes physically dependent, because without this alcohol the person will have various symptoms like tremors, irritability, disturbed sleep, anger, rage, etc. Whereas whenever a person stops this for a short period of time, within 24 hours to 48 hours, a person will develop various types of withdrawal symptoms like tremors, headache, nausea, and sometimes even visual and auditory hallucinations. And in severe cases, it can lead to stroke, seizures, etc. And when it comes to the tolerance, see, tolerance is a condition where a person has to drink more amount of the quantity of alcohol to get the same effect that he was getting earlier with a smaller amount. And there are various types of alcohol-induced psychotic disorders which can be psychosis, delusion, hallucinations, etc., which can be leading to the chronic alcoholisms. Ayurveda also describes about all these alcoholic disorders under the broad spectrum of Madatya. All types of Madatya are Tridoshaja and it afflicts the Ojas. And Ojas is the essence of the tissues which is present inside the body. There are various types of Madatya, but chiefly there are four major classifications of Madatya based on the types of the dominance of doshas. There are Vataja type of Madatya, Pittaja type of Madatya, Kaphaja type of Madatya, and Sannipada type of Madatya. In Vata type of Madatya, the common symptoms that we come across is difficulty in breathing, pain in the joints, pain in the hands, tremors, etc. In case of Pittaja type of Madatya, a person will have burning sensation, fever, confusion, giddiness, etc. In case of the Kaphaja type of Madatya, a person could have heaviness inside the body, nausea, vomiting, lethargy, etc. Whereas in case of the Sannipada type or the Tridosha type of Madatya, you can have the combination of all the three doshas. Apart from this, there are other clinical spectrum like Paramada, Panajina and Panavibhrama, which are the manifestation as hangovers and alcoholic indigestions. Whenever a person is reintroducing after abstinence for a particular period of time, there are two more clinical spectrum called as Vikshaya and Dvamsaka, which are described in the authoritative Ayurvedic text. Even the acute intoxication has been explained in the form of the stages of Mada. There are three basic stages of Mada: Prathama Mada, Dvitiya Mada and Tritiya Mada. It depends upon the amount of the alcohol that is present inside the body. The concentration of alcohol that is present inside the body is called as blood alcohol concentration. Generally, the blood alcohol concentration is 0.01. When we say it is 0.01, it means that the body has 0.01 gram of alcohol in 100 ml of blood. A standard drink will increase the blood concentration by 0.01. Similarly, the various types of the mada has been explained, and it can easily be correlated with the concentration of alcohol. In the Prathama Mada, a person will have well-being and good coordination, will have confidence and happiness. In the second stage of Mada, a person loses coordination, there will be lack of imbalance, lack of memory, tremors, and a person will start talking irrelevantly. Whereas in the third stage, where a person could go into the severe memory loss, confusion, convulsions, and in some of the cases, it can also lead to death. And it's the same correlation that can be done with the help of the blood alcohol concentration. The same thing, I think many people might be seeing, that you are checked by the policeman in the roadside, and this is what they check, the blood alcohol concentration. If the blood alcohol concentration is more than 0.03, then it is said to be illegal, and that is where a person could be penalized for its illegal use. And these are the various types of clinical manifestation that we could come across in various types of alcohol use disorder.
Okay, sir. So generally people, they are fascinated by some advertisements in newspapers and all, claiming, there are some powders which can be given unknowingly to the person and they can be de-addicted. So what is your take on this, sir? Is that the right way to manage alcoholic disorders, or do we have a different treatment line altogether in Ayurveda?
See, as you have mentioned, Dr. Soumya, that this is a condition which will affect an entire compass sphere of the physical, mental, social and financial ill effects of an individual. Similarly, the management also should be very holistic. It should address the various issues related with an individual. So that is where the types of management can be broadly classified as the pharmacological management and psychological management. Pharmacological management, if you come to the management of alcoholic disorders in the contemporary science, there are various medicines which are commonly used. The most common drug which is used is disulfiram, which is a drug which will inhibit various enzymes and lead to a sense of ill well-being, where a person will have nausea, vomiting after consumption of alcohol. But it is ultimately the motivation which will have a major effect on the overall treatment of an individual. And along with that, there are various types of benzodiazepines and other pharmaceutical management which is used for management of alcoholic disorders. And when it is clubbed with other psychological management, the holistic management is proved to be very effective. Ayurveda also talks about the three major lines of treatment for the management of alcoholic disorders. The three major management of alcoholic disorders includes Daiva-Vipashaya Chikitsa, Yukti-Vipashaya Chikitsa and Sattvaja Chikitsa. Daiva-Vipashaya Chikitsa are the exclusive psychosocial practices which are used for the maintenance of health, which includes various types of mantras or the hymns like Sudarshana Mantra, Gayatri Mantra, Vishnu Nama, Sahasranama, etc. and various types of Yama Niyama, Pranipata Gamana, etc. which are said to be very beneficial in the treatment of alcoholic disorders. Apart from this, as it will have a major effect on the body and most of the organs of the body, the detoxification plays a major role. That is where the Yukti-Vipashaya Chikitsa or the rational therapies will have a major role in the treatment of alcoholic disorders. Various types of Panchakarma, Shodhana therapies as well as Shamana therapies are very beneficial for the management of alcoholic disorders. Initially, after evaluation of the individual, one can always plan for the Panchakarma, especially Vamana Karma or Basti Karma are said to be very beneficial in the management of alcoholic disorders. And after a person has been detoxified, various types of herbal preparations, herbal formulations, herbal mineral preparations are used for the management of alcoholic disorders. It could be various types of preparations like Shrikhandasava, Kharjuradi Mantha, Arjunarishta, Partharishta, Draksharishta, etc. or various types of churnas like Ajamodadi Churna, Hingvashtakavati, etc. Or there are single herbs which are said to be very beneficial like Guduchi, which is Tinasphora cardifolia, Bringaraja, Eclipta alba, Ashwagandha, Withania somnifera, it could be Brahmi, Bocopa monoria, Kushmanda, Benencasa hespida. Various types of these single drops can be effectively managed for the various types of the symptoms related with alcoholisms. And when the same treatment is coupled with the psychotherapies, it will have major effect on the body. The psychotherapies, or what in Ayurveda we call it as Sattvaja Chikitsa, will play a major role in the management of alcoholic disorders. Sattvaja Chikitsa are the various psychosocial reframing of the body from the mind, and that is where the different types of counseling like individual counseling, family counseling, groups counseling, brief intervention counseling plays a major role for the treatment of alcoholisms. And apart from this, if a person can club all these symptoms, and if a person is really motivated towards quitting the alcohol, the Ayurvedic treatments and the various pharmaceutical and pharmacological treatments, psychological therapies can play a major role in the treatment of alcoholisms.
Okay, sir. So, as you were mentioning about self-motivation, can we do something on the preventive aspect so that we can help people, especially the younger generation, to get self-motivated, thus preventing them from getting into this habit of, alcoholism?
See, we always say that prevention is better than cure, and it is very much applicable for the management of alcoholic disorders. Any amount of alcohol, any type of alcohol will have some or the other ill effects on the body. Alcoholism is never safe. So that is why it is always better that we can restrain ourselves from alcoholism and thus prevent ourselves from alcohol related disorders. As rightly said that Nityam Hita Ahara Vihara Sevi Samikshakari Visheshu Asaktaha Dataha Samaha Satyaparaha Kshamavan Aptopasevicha Bhavanti Aroga. One who is in regular practice of dietary habits, regular physical activities, restraining the body from unwholesome activities, being analytical, and involving the activities of charity, kindness, and forgiveness. And if a person practices all of them, a person can be away from all the types of addictions, especially alcoholisms. It is rightly said that it is always to be said no to alcohol first time, every time. There is a small quote which says that how to prevent the alcoholisms and related disorders. There is a small quote which says that it is A, B, C, D, 4, 3, 2, 1, where A stands for away from distractions. There are so many distractions which comes inside our life, and we need to restrain ourselves from this distraction. B is being organized. You should have a schedule for your life, a goal for your life. C is being cheerful. Be happy what you're doing and do what makes you happy. D stands for daily exercises. At least 20 minutes of exercises 5 times a week is very, very important to keep you physically and mentally happy. And 4, 3, 2, 1, 4 stands for 4 liters of water, 3 times timely balanced sattvic food, 2 times of yoga, meditation, and at least have 1 recreational activities which is going to keep you happy and keep you engaged. If you follow all these practices on a regular basis, definitely you can be away from all the types of addictions and keep yourself happy and healthy.
Thank you so much, sir, for enlightening us with all your valuable information regarding this topic. We are so much thankful for your time among your busy schedule. Finally, what message would you like to give to the masses watching this?
See, as rightly said that prevention is always better than cure. As this is a condition which affects physical, mental, social and the spiritual well-being of an individual, it is important that we stay away from such addictions. And if at all there is such issues related with alcohol and alcoholic disorders, it is always better that we approach the doctors or the physician who can help out of this. But ultimately, it is a self-motivation which is ultimate in the management of alcoholic disorders. I thank the organizers for this wonderful opportunity to be a part of this innovative program.
Thank you, sir. Thus, to sum up today's session, we understood that the Early detection of alcoholism can really be managed with Ayurveda, and it is helpful in bringing an alcoholic to a normal, healthy life. As always, prevention is better than cure, and preventive activities, especially in late adolescence and early adulthood, can really cure this problem at its root level. Thank you.